Welcome to our continuing education course on advanced directives. In this training, we'll explore what advanced directives are, why they matter, and how caregivers can support individuals in honoring their medical care preferences. Course objectives. Define what an advanced directive is, understand types of advanced directives, learn how they impact caregiving, recognize Arizona-specific requirements, know how to support individuals and families. By the end of this course, you'll have a strong understanding of the role advanced directives plays in healthcare and how to respect and support those decisions in your caregiving role. What is an advanced directive? Legal documents that outline a person's medical care preferences, expresses a person's healthcare wishes, activated if the person becomes incapacitated or if the individual cannot speak for themselves, help guide families and healthcare providers. Advanced directives are legal documents that communicate a person's healthcare wishes in the event they can no longer express themselves, typically due to illness or incapacity. These directives serve as a guide for family members, caregivers, and medical providers during critical healthcare decisions. Why are advanced directives important? Promotes autonomy and dignity while ensures wishes are respected, reduces stress for families or potential conflict, guides medical professionals and provides clear guidance during emergencies, ensures legally binding care choices. Advanced directives protect the individual's right to choose their care and help loved ones and medical providers make informed decisions that align with their values. They also reduce emotional stress for families during emergencies and offer clarity for medical teams and caregivers. Types of advanced directives. Living will. Durable power of attorney for health care. Do not resuscitate or DNR orders. Most forms. Provider orders for life-sustaining treatment. There are several types of advanced directives. A living will details specific treatment preferences. A durable power of attorney for healthcare names a trusted person to make decisions. DNR orders and post forms provide instructions about life-saving interventions. Let's break each one down. Living will. A living will allows individuals to state their wishes about life-sustaining treatment and end-of-life care. This can include preferences on ventilators, feeding tubes, and more. In Arizona, a living will or advanced directive is a legal document that allows an adult to express their wishes about medical care, particularly if they become incapacitated and unable to communicate their preferences. It dictates how their health care should be managed, including the use of life-sustaining treatments like cardiopulmonary resuscitation or artificially administered food and fluids. Details specific medical treatments the individual wants or does not want. Covers resuscitation, feeding tubes, and life support, etc. Durable power of attorney for healthcare. This directive names someone to make medical decisions when the person is no longer able. That person must understand and respect the individual's values and wishes. A durable power of attorney for healthcare is a legal document that allows you to appoint someone to make medical decisions for you if you become unable to make them yourself. This person, often called an agent or attorney in fact, can communicate with doctors, make treatment choices, and access your medical records. This document appoints a trusted person to make decisions, and it only takes effect when the individual is unable to make their own decisions. Do not resuscitate orders, also known as a DNR. A DNR is typically used in advanced illness or frailty, where CPR may do more harm than good. It must be signed by a doctor and kept readily available. A Do Not Resuscitate order is a legal document that instructs healthcare providers not to perform CPR, cardiopulmonary resuscitation, if a patient's breathing or heartbeat stops. It's a way for individuals to express their wishes regarding resuscitation in the event of a medical emergency, ensuring their preferences are followed when they are unable to communicate them. This is a physician's order, and it indicates that CPR should not be performed. Post-most forms, provider orders for life-sustaining treatment. Unlike a living will, post forms are medical orders and are more immediate. They guide EMTs and ER staff in critical situations. Post, physician orders for life-sustaining treatment, and most medical orders for life-sustaining treatment are similar forms used to guide end-of-life care decisions, especially for patients with serious illness or frailty. These forms allow individuals to communicate their treatment preferences with healthcare providers, including decisions about CPR, medications, and other treatments. They are typically signed by a healthcare professional and the patient, or their designated decision maker. These documents are specific to serious illness or frailty. This translates wishes into actionable medical orders, and it must be signed by a provider. Arizona laws and requirements. Arizona honors all major types of directives. Must be signed and notarized or witnessed. Register with the Arizona Healthcare Directives Registry, which is optional. Arizona law allows for several types of advanced directives. These specific forms are legally recognized. They must be properly signed and either witnessed or notarized. Arizona also offers a registry where individuals can store their directives for easy access. How to have the conversation. Starting the conversation about end-of-life preferences can be emotional. As caregivers, it's important to approach it with empathy, patience, and a willingness to listen. It can be sensitive to talk about end-of-life care, but it's also important. Approach the conversation carefully. Encourage clients and families to discuss their wishes. But remember, you are not authorized to give legal advice. Choose the right time and setting. Use open-ended questions. Focus on values and goals. Offer support, not pressure. Use calm, respectful language. Encourage family involvement. And offer printed resources. Caregivers' role in respecting advanced directives. Be aware of the existence of directives. Keep a copy on file and keep it accessible. Respect and follow stated wishes. Advocate for the individual's wishes. Communicate any relevant changes to supervisors or nurses. As a caregiver, you're a crucial advocate. Know the directives' details, share them with providers, and ensure care aligns with what the individual wants. As a caregiver, you play a vital role in upholding your client's wishes. Know whether an advanced directive is in place and always respect and follow the instructions. If you're unsure or if changes arise, notify your supervisor immediately. Common misunderstandings. A directive doesn't mean give up. Only applies when the person can't decide. Doesn't prevent comfort care. It's important to understand and help others understand that advanced directives aren't about giving up, but about having a say in care when it matters most. What if there's no advanced directive? Decisions are typically made by next of kin or legal guardian. They can lead to family conflict, or they may delay or complicate care. When there's no directive, decision-making defaults to family or guardians. This can create tension or uncertainty during already stressful times. Case study examples. A client with a DNR collapses. What should you do? A family disagrees with the client's documented wishes. A client asks you to help change their directive. These real-world scenario highlights the importance of understanding and honoring the directive, regardless of outside pressure. The caregiver must communicate clearly and involve medical professionals. Let's consider all of these real-life scenarios. What would you do if your client fell and had a DNR, or a family disagrees with their loved one's directive? Understanding how to respond ethically and lawfully is key to being a responsible caregiver. Best practices for caregivers. Review directives regularly with the care recipient. Respect cultural and religious beliefs. Keep documentation accessible. Communicate proactively. Following best practices ensures respectful and informed caregiving. Regular review, cultural sensitivity, and effective communication can make a big difference. Supporting families through process. Educate and empower. Offer empathy and a listening ear. Respect cultural values. Avoid judgment. Every person has the right to choose their care path. Provide resources. Caregivers also support families. Provide a safe, compassionate space to explore difficult decisions is one of the most meaningful parts of our role. Advanced directives are rooted in respect. Everyone deserves the dignity to choose how they want to live and how they want to be cared for. As caregivers, it's our job to support those wishes without judgment. Additional resources. Here are a few additional resources available to you. Arizona Healthcare Directives Registry, Aging with Dignity, 5 Wishes, National Hospice and Palliative Care Organization, your local area agency on aging. These resources offer templates, legal guidance, and emotional support as individuals and families create their advanced directives. Final thoughts. Advanced directives reflect personal values and dignity. As a caregiver, your commitment to honoring these choices is a powerful expression of respect and compassion. Before we finish, remember these key points. Know your client's directives. Keep documentation available. When in doubt, ask. And most importantly, always act within your training and responsibility as a caregiver. Respecting advanced directives is about dignity. It honors the individual's right to choose. You play a vital role. Always act within your scope of practice. Thank you for completing this course. Next, please make sure you take the quiz to check your understanding of advanced directives and how they apply to your role as a caregiver. A passing score is required to receive credit for this course.